in prevention work at HIV Alliance, I guess our overall mission is supporting individuals living with HIV and AIDS and preventing new infections. When you start to ask, what does preventing new infections look like? The floodgates really open up. And the answer is usually a lot of on-the-ground outreach. The fastest growing demographic of people who are contracting HIV right now are people who inject drugs and the risk that comes with sharing syringes. At Syringe Exchange, it is, I think, one of the most accessible, low barrier things that we do. It's very much a no judgment zone. We don't have expectations or any sort of latent ulterior motives for people's, behaviors that they don't have for themselves. All we want is for them to be safe. We do take in over 1 million syringes every year off of the street. Most of the time people don't realize that Exchange does actually reduce the amount of syringes and paraphernalia and stuff that you're going to find out on the street. And more importantly, it saves lives. It's also a really low barrier access point. And so it is, for some folks, one of the only consistent places where they can show up and be themselves and know that we're going to be there and not judge, we're there to connect you to resources. If you want to get on PrEP, we always recommend that. We also, we have peers who can help people get into recovery services and stuff if that's what they want. But if it's not their goal, it's not ours either. The number of overdose reversals that gets reported back to us from the Narcan we give out is astonishing. And it saves thousands. A lot of this work requires you to recognize that people are autonomous individuals who make decisions for reasons that make sense to them and what they have going on in their lives. A lot of the time, drug use is the last thing, the least of their problems, and often a solution that makes sense. If you're on the street where sexual assault and other sorts of violence is rampant, and it's that you need to stay awake to stay safe, a stimulant is not your enemy in that situation. You do sometimes have to watch people make decisions that are, not ideal as far as health outcomes or safety outcomes, but they're doing the best with what they have at the time, and it's your job to be there each time. And okay, so maybe you shared a syringe with somebody last week or whatever, but you're here now to get new ones. So that's great. And why don't you get tested while you're here? That sort of slow engagement with somebody who sees you as a person, sees you as a part of their community, can be the bridge that can get them connected and getting them feeling ready to get out of, try and get out of situations that maybe they're in abusive or violent homes, maybe they're on the street, maybe they've been let down a lot, so they're not necessarily willing to just trust people in social services. But if they've seen you, every week for months and have learned to trust you and know that you see them, it can be a great connecting point for a lot of things.